Well, good afternoon, everybody, and welcome to today's Health and Wellbeing Board for North Northamptonshire. I apologise in advance for the heat in the room, but we do have cool water at the back of the room. So if you do feel that you need to be hydrated, please just get up and get yourself a cup of water. We're going to move. I've been told that there's no fire drills planned for this afternoon. So if the alarm does go off, then please make your way to the nearest exit and make your way down the fire exits to the muster points outside the building. We'll start with item 1, which is apologies. Do we have apologies for today's meeting?
Yep. We have apologies from Councillor Matt Davies, from Toby Sanders, Johnny Bugg, Trevor Shipman, Jacqueline Parks, Anne-Marie King, Samantha Fitzgerald, Colin Foster and Philip Powles.
Okay, thank you. We'll note those apologies. I believe there's been no notifications for addressing the meeting for the public. Is that correct?
Yep.
Okay, so we're now through 2 agenda items in very quick time. Going to move on to declarations of interest. So I'm going to invite board members to declare any disclosable pecuniary interest or non-statutory disclosable interest in items on today's agenda. If board members declare such an interest, they must remove him or herself from the whole of the item on the agenda. When declaring an interest, board members are asked to state the item in which the item number in which they have an interest, the nature of that interest, and whether that interest is a disclosable pecuniary interest or non-statutory interest. So I'm going to start with myself, if that's okay with the rest of the board. So my interest, and you hear me declare this at every meeting, is that I'm a council-appointed governor at NHFT, Northamptonshire Healthcare Foundation Trust. So that's my declaration of interest. Are there any other declarations that need to be made on today's agenda? No? Thank you very much. We'll move to the minutes of the previous meeting, which was held here at Corby Cube on Tuesday, the 18th of March. Are there any corrections that anybody wants to raise on those minutes? Presumably everybody's had a copy to read. So just looking around the room, nobody's raising any changes. So is the board happy that I sign these minutes as a true and accurate record? Can I have a show of hands in favour? Against? Any abstentions? I'll be happy to sign those minutes. Thank you. Okay, on to the next item of the agenda, which is the action log. I have checked with the officers, and the action log appears to be empty. So there are no actions to follow through, which is good to hear. But there may be some coming out of today's meeting, and we'll add those in. So, action log completed. Okay. So, for those that I haven't met, I have tried to meet most people as they come in the room. But my name is Brian Bennyworth, and I welcome our new board members and those attending the meeting for the first time. We encourage all board members to contribute to discussions, but please do raise your hand and wait to be recognised by myself before speaking, which ensures that everybody is clearly heard and does help the minute taker. And when you go to speak, if you can just press on the front of your microphone and wait for the green light so that we can record what you're saying. Okay, we're going to move on to item number 7 now, which is our health and wellbeing strategy and overview. Before we go into this item, I just would like to take a moment to show some appreciation to Councillor Jill Mercer and the previous administration, all the officers and all the members of the Health and Wellbeing Board that have been responsible for putting this really well thought out document together. So I just wanted to take a minute to express my thanks as the new chair for all of the work that had been taking place to produce the Health and Wellbeing Strategy. So I'm going to hand over to, I think, Lee. It says here that you have 30 minutes, but I'm not sure that you're going to take that long. Okay, thank you.
I think we scheduled this item mainly because we knew we had new board members and new chair. So I think most people around the table have heard about this strategy before and the history behind it. But we thought we would just go through and do a very brief note, which appears to have translated into 30 minutes, which I will not be filling by reading out the strategy. The strategy was attached with the action plan as part of the minutes. I think it's worth saying that there was a lot of background to this particular strategy and a heck of a lot of partner involvement, and it's based on the evidence and the evaluations from that. It wasn't something that was lightly put together. It was heavily consulted on. One of the things that's happened recently was that there was a public feedback exercise relating to the strategy action plan. And the plan is to bring that feedback summary to a different meeting. It didn't feel right to bring it to the first one without actually talking about the strategy first. I think most people, as I said, have seen this. The reason for its construction around 5 specific outcomes was to give it a clear definition of where we were going as a board, rather than try and solve everything for everybody. And look at that, on, as I said, on the basis of evidence, of what did the evidence tell us. And it came out with these 5 priorities. Smoking and vaping, which has its own strand, and keeping active, again, which has its own strand and based on enabling active lifestyles. Mental health and wellbeing, children and young people, and financial resilience. I think you'll see from previous minutes, most of those things have come as one-item tickets. They come to board with a range of updates, strategic points during the year, so not all of those will come to every board. Each one has an action plan sitting underneath it, and a key officer that has oversight of that. I don't believe anything is due imminently, but each of the 5 broad areas do come to board. Alongside the strategic aims of this is an action plan which has also come into board, and as I said, that has been out for consultation of whether that makes sense to people, whether it's user friendly, can we rely on this, and then part of that is that it comes back into board to oversee. I'm not going to go into the action plan or the strategy.
Thank you, Lee. That's an excellent overview. Okay. I'm going to hand over to Jane Bethea. I hope I've got that right, Jane. Or Bethea.
We're not working.
Saved by the DAS. Thank you, David. It's Bethea. It's fine. It's one of those surnames. I just wanted to say a couple of words, if that's okay, Chair, about the strategy, because I'm aware that lots of people here have been heavily involved in this and maybe getting slightly tired about hearing about the development of it. But for new members, I just wanted to raise that the governance of it is very important. So one of the things that we've committed to is a strategy that is not passive, it's active. So the strategy has areas where we're doing things that otherwise wouldn't have happened, and that's really important, I think. So, for example, the work we want to do in Corby around smoking, the work we want to do around really galvanising our efforts around childhood obesity. There's a whole range of things in there that wouldn't have happened otherwise. From a governance perspective, it's really important that the board is able to respond to challenges and areas where we are not seeing the progress we want to see. So, for example, we have a board that sits below a group that sits below this board called the Health and Wellbeing Oversight Group, and that specifically looks at those different areas and asks the leads for those areas to do highlight reports about what's going well, what's not going well, what things do we need to do as a system to really address that. And then where needed, that will be escalated to this board, and this board agreed to that as part of the planning process. I'd also like to take this opportunity to thank our executive sponsors, many of who are with us today. One of the other things the board really wanted to see was ownership of the strategy. It's not a council strategy, it's a much broader strategy than that's for the whole system, and a number of people stepped forward into that space. This gives us extra external scrutiny, I feel, of what we're doing around the health and wellbeing strategy, but also helps us think innovatively in that space about the things we're doing. I'm thinking, Chris, about your fantastic position from Northamptonshire Sport and how that's helping us get that physical activity piece of work really live and meaningful. So we will be bringing additional papers to the board on updates on where we are. The work is ongoing. There is funding attached to that as well, which allows us some of that innovative space. And I think what we'll be doing is looking to the board for some support when we need it, but also to provide the board with assurance on progress.
Thank you, Jane, and I apologise for not getting your name quite right. Are there any questions? If you can raise your hand if you'd like to ask a question about the health and wellbeing strategy. Looking around the room. No hands? Okay. Well, the recommendation is for the board to note the progress on the health and wellbeing strategy and action plans. Can I take it that we note the progress to date and encourage this great document to keep live, keep active, and keep going? Okay, thank you. Right, moving on then to agenda item number 8, we have a SEND priority update plan. This report provides an update on the progress made on the Northants SEND priority action plan, which was launched in May 2024. And it sets out actions across 4 key priority areas. Can I invite Troy Hubbs to present the update? Thank you.
Thank you, Chair. I think you've just done my presentation for me. Thank you, members, and I'm pleased to give you an update on the overall progress that's being made on the Priority Action Plan and wider. If I may, what I'd like to do is just set a bit of national context. England is in the midst of unprecedented rises in the number of children and young people being identified with special educational needs and or disabilities, otherwise SEND. There are, as of January this year, there were 638,000 education, health and care plans. That's the statutory document that records children and young people's most complex needs and the special educational provision that they should be receiving. Beyond that, there were around 1.8 million children and young people in total who were identified as having special educational needs and or disabilities. Not all of those with an education, health and care plan. Nationally, those numbers of education, health and care plans grew 10%, as they have been growing pretty much year on year since the current legislation, the Children and Families Act, was brought in 2014. In Northamptonshire, to bring this into context, from the council's inception in 2021, we have grown from around 2,900 children and young people with education, health and care plans to the latest national comparative data published in January being 4,551. And since January until today's date, we have now just topped over 5,000 children and young people with education, health and care plans. So I hope that gives members some sort of context as to the, as I said, I don't think it's an overuse of the word at all, the unprecedented position that we and every other local authority in England is finding itself in. So to come back to the report, in January 2024, the Northamptonshire Local Area Send Partnership, as Jane was mentioning also about the health and wellbeing strategy, this is not a strategy that is owned solely by Northants Council, but rather by the key stakeholders and partners, many of whom are in here today. The inspection of our response to the local area demand and need for special educational needs and disabilities found significant areas of weakness in the four overarching areas that the Chair just highlighted. And so within that context, there had been significant and repeated changes in interim leadership, a lack of a clear defined strategy, and within that overall unprecedented growth in demand that I mentioned. The Priority Action Plan is the response to the written statement of action that the Local Area Send Partnership was required to provide, and that was accepted and signed off by the Department for Education and the Care Quality Commission, NHS, in May 2025. The result of that being ultimately that this Local Area Send Partnership will be due a re-inspection no later than 18 months from the date of that report, and so that takes us to November this year. And so a great deal of effort has been going on over the last 18 months in response to that inspection, the written statement of action, the priority action plan. And I'll just quickly run you through the highlights of that, because I'm sure you've all had an opportunity to read the report. In terms of partnership working, there has been significant improvements in, and I think it's right to bring in the context of governance here, significant improvements in working between the key partners and within a governance structure. So there is now a Send Accountability Board, which is independently chaired, and that board, made up of the key partners, including Northamptonshire Parent Carer Voice, our Parent Carer Forum, holds itself and its partners to account in delivering to the Priority Action Plan areas. So that's a major achievement, and good progress is being made there. Similarly, in the field of joint commissioning, joint strategic commissioning, there has been a refresh, as has been previously brought to this board, about the joint strategic needs assessment, which takes the broadest sort of universal view of children, young people and families' needs in Northamptonshire, and then relates that to children, young people with special educational needs and or disabilities and our responses to that. Joint commissioning arrangements are still ongoing and developing in response to those activities, so that we are now better able to forecast the numbers of children and young people who might be coming through into the system and who might ultimately need an education, health and care plan. I've talked briefly about the third point, governance and leadership. Of course, it would be remiss to not highlight that we've had a recent change or departure of our Director of Children's Services. Work is ongoing within the corporate leadership team of Northants at pace, and there will be an internal announcement tomorrow about the interim arrangements that will be made since the previous director's departure. But nonetheless, there are really strong and clear governance arrangements and continuing leadership arrangements around that, including an interim senior leadership team and good work around those governance arrangements to hold the system to account, including working with our new members, of course. Finally, the fourth priority action area was accurate assessment of needs. I've given you the numbers of children and young people that are coming through the SEND system, if you like. One of the most sort of like headline grabbing aspects of that is how quickly does local authority produce its education, health and care plans. There's a statutory time frame of 20 weeks to produce those. In August last year, our timeliness on that measure was just 7%, so the lowest it had been. It had previously been held high relatively in the 2 previous years, despite all of those instabilities that I mentioned. Significant and focused effort was put into growing the education, health and care team, and also working with every professional and their services that contribute to that process. And I'm really pleased to report that month on month we've achieved increased and improved timeliness, such that last month we were reporting timeliness of 74% of EHCPs completed on time. Alongside that, it's really important to not just churn an EHCP out, it has to be personalised. personalised and be quality and actually talk to that child or young person's aspirations for their future. And so a quality assurance tool was introduced based on work in other local authorities, and that allows us to benchmark the quality of those EHCPs against other local authorities. I'm really pleased to say that whilst we've only had a small handful of exceptional plans, that the fact that we have produced those is really good and pleasing, but the volume of plans that come into a measure of good or better is increasing again month by month. And anecdotally, through the Northants Parent Carer Voice, we're really pleased to receive positive feedback from MPCV that families are noticing a change in the quality of their children and young people's EHCPs, and that they relate more to their personal circumstances. I'll just whiz through, if I may, the next section, because I don't want to read all of those out, but it does reflect, section 4, summary of core progress, really does reflect the vast amount of very concentrated activity and effort that's been put in by all partners to address the priority action areas and go beyond that as well. So what the report doesn't include, for example, is the huge amount of engagement that has been going on with parents, carers, stakeholders and partners, in addition to what it does say around looking at how we transform our SEND offer locally. And that has contributed in a very significant way to contributing to a refresh of our local area SEND and inclusion strategy. That's currently in its final stages of draft. It's been scrutineered, co-produced, including with parents, carers and the MPCV and professionals. And we will be launching that as soon as it goes through approval at the SEND Accountability Board. So there's a real synergy between the priority action plan areas, which of course identified those areas of immediate concern, but the work around the SEND transformation and the refresh of the SEND strategy is taking us beyond just addressing risk and failure there, but also laying out a blueprint for the future of how we want our SEND and inclusion work to look in Northants. The final section I would just mention, issues and choices. I'll just pick out a couple of there because these do reflect the continuing challenges that we have in Northamptonshire. I've talked about demand and pressure. There has been a change nationally, and reflected here also in Northants, in parents' preferences for where children and young people might be educated. Almost entirely for the 30 years prior to the 2014 legislation change. And in accordance with the continuing intention of inclusion, the vast majority of children and young people with special educational needs and disabilities were always educated in mainstream school, with appropriate support, of course. And a growing number of specialist or special school places were always necessary in terms of attending to the volume, the increasing numbers of children and young people with SEND. There are some children and young people, for example, where it would really only be suitable that their needs were met in a specialist setting. But for the vast majority, it was always been about inclusion in mainstream. Around 2020, 2021, there was a tipping point reached where if you take all specialist types of settings into account, the majority actually of children and young people were now starting to attend a specialist setting of one type or another. We're really fortunate in Northamptonshire, that we have 7 excellent, good and outstanding special schools to serve the local community. We also have a number of mainstream schools that have what we call either SEND units or additional resource provisions. That's where children with more complex needs who might not necessarily want to go to, or need rather, to go to a specialist centre setting, and or where parents still prefer their children to go to a mainstream school, they can have their special needs met there. So we have a really good offer comparatively for the size of our authority. With that being said, every single aspect of that offer is under pressure. All of our specialist settings are full or over full despite expansions, and so also are the majority of our resource provisions and SEND units. And so we have been just concluding an expression of interest round to all of our mainstream settings to invite them to grow more specialist placements in those mainstream schools. And that is our strategy going forward, with the ambition of growing up to 800 new additional resource provision or send unit places by 2032-33 in Northamptonshire, and that's the forecasting work that I mentioned earlier, where we believe we need to meet demand. So we do also then have to meet children and young people's needs and demands now, and we do, where it's appropriate, willingly, where it's not so, reluctantly perhaps, have to make use of the independent specialist sector, where costs for placements are usually twice or 3 times the cost of what can be achieved in a main state-funded sector. So those challenges bring budgetary pressures, and I think we've reported here, and certainly in other committees elsewhere, the pressure that is on the high needs block of the dedicated schools grant, which this year has an in-year pressure of £19 million, and that is growing. So the work that I've described here today, not only in addressing the priority actions of the systemic issues that were raised in the local area SEND inspection, but also in the transformation work that the partnership is undertaking and the Refresh SEND strategy, is also very focused on addressing that overspend and trying to at least reduce the growth of that overspend, but ideally, of course, to reduce the overspend itself. That, within the national context, continues to be the challenge that every local authority in England is facing currently. But overall, I would like to commend the report to the board today as a reflection of the substantial, significant and focused effort that every partner within the local area SEND partnership has made, and to recognise the progress and improvements that are being made and continue to be so. Thank you.
Thank you, Troy. And can I thank you on behalf of the board for stepping in to present this report. It's very clear from reading the paper and listening to you today that there's been some significant progress made, and I commend that to everybody that's involved. So keep going. It's going in the right direction, but we note the significant pressures that are under at the same time. I'd just like to invite any of the board members, if they have any questions for Troy. Caesar, is it Prince?
Yeah, Prince.
Sorry,
yeah, that's
Prince.
right. No, that's all right. Chair, thank you for that presentation. I think that is very, it shows the progress being made and very substantial ones. Just a couple of things I wrote down. You gave a breakdown in terms of the CYP SEND numbers from 2021 and 2009, and then to 5,551, and currently you're looking at 5,000 CYP SENDs. Chair, I would like to know whether you have a breakdown in terms of this 5,000 and that breakdown, and what kind of groupings we have in that breakdown in terms of ethnicity and things like that. Is there any data on that?
Yes, of course. We've got granular data on every aspect of that. We don't have it in the report, but we'd be very happy to share that in the formats. If I was just to give a very brief summary of what I recall from memory. So currently at around 5,000 or so education, health and care plans, the vast majority of those will be in 3 categories. There are 12 primary areas of special educational needs that are recorded and reported to the government. And of those 12 categories, our 3 primary areas of need are cognition and learning, autism, and social, emotional and mental health. And they will probably be reflected in the majority of local authorities or local areas up and down the country rather. In terms of numbers of where those children and young people attend, I am doing this from memory, but there is around about, I'm sorry, I'm not going to do it from memory because I would give the wrong numbers, but we certainly provide those numbers. And we have all of that data down to a granular level. And that information helps us to forecast the type of special educational provisions that we might need to develop, and also to work with our partners, particularly in health, around autism and assessments and those sorts of aspects in order to meet those needs. The intention and the ambition would always be to meet children and young people's needs as early as possible so that they don't necessarily need to progress to those statutory processes.
Chair, can I do a quick follow-up? I'm also aware that when it comes to this breakdown of numbers, some from underrepresented communities have a tendency of not presenting when children are in that particular category, or they might not be aware of, and whether there is a need for some kind of strategic campaigning and engagement at that level to create that awareness, and then that might also reflect on the numbers that we currently have. Thank you, Chair.
Thank you. Yeah, thank you for that additional question. Again, our data will break those numbers down into ethnicities, gender, localities, down to small geo areas. In terms of communities who may not necessarily be aware of or culturally less inclined to engage in those services, we do, as every local authority, will have two key things. Firstly, as I've mentioned, the Northamptonshire Parent Carer Voice. Every local area is required to support via funding, via grant funding rather, the development of a parent carer forum, and we encourage that parent carer forum to engage with all aspects of the communities that they serve. For example, we have just had them carry out, they are just carrying out an annual survey with all of the families of Northants that wish to engage in that. The second aspect is every local area is required to have an independent information, advice and support service, which we again have that. It's at arm's length of the local authority, so it must be seen to be and act independently and impartially. That there is to serve families who can access that free at point of access, and to gain any information, advice or support that they need regarding their children's or young people's SEND.
Thank you, Prince, and thank you once again, Troy. We'll make an action of that, Prince, so that we can gather that data and circulate it to board members. Thank you. Are there any other questions? Pratima.
Thank you for this, and I heard another comprehensive presentation at the ICP recently on this, so I'm really pleased to say, to note the progress. Just because it's of such importance, obviously, this work. If you were nearing November, what would be your confidence levels in terms of what CQC would say, based on current progress? And what impact has the recent change with the leadership meant in terms of the executive director as well? And also, what would parents say at the moment in terms of what they feel about the progress? I know there's something in the report about their feedback, but it'd be just good to hear from you.
Thank you. I haven't got a pen and paper, so you might need to remind me of the questions. In terms of confidence around our readiness for a local inspection, I don't know. I don't think that would be for me to put a marker on that individually, because it's a local area system response. What I can do is reflect back to the report, and in there you will see that we, that is the local authority and HFT, our key stakeholders and partners, meet regularly with the DFE and the CQC around kits, keeping touch meetings, kits, and also stock takes. There's a variable formality between those meetings. Some are absolutely holding our toes to the heat to understand and test, what progress have you made, show us, demonstrate it. And that is typically triangulated also with those bodies' engagements with the Parent Carer Forum as well, so that we have an independent or a sort of a service user view. I think there has been, my only reflection is at a personal level, and in my role as interim head of SEND, is the remarkable volume of activity that has happened in the last 18 months. I've worked in several local authorities. I haven't seen this much condensed, focused activity in such a short amount of time in other areas. And so I think that bodes well. Ultimately, it will be for the inspectors to come to their judgment when they do arrive. I'm glad to say it can't now be this side of the summer holidays because of the lead-in time that's needed around the notification. It could, though, be the very first week of September. So, we are readying ourselves for that in terms of preparing what's called the Annex A, all of the key documentation around showing our story, showing the progress, coupled with what DfE and CQC inspectors, officers pull out of those stocktake meetings when they meet with us and test us. That will all contribute to ultimately the judgment. It's a high bar, I would say. I think my last note was that more than half of local authorities in England, since the introduction of the local area centre inspection in its first iteration in 2018, more than half of local authorities in England were required to produce a written statement of action. We're now in a further iteration of that inspection regime, introduced in 2021-22, which is now moving away from tell us what you've been doing to now testing, so what? What does it mean? That's the key question now, and I think it's the right question that CQC and DfE are interested in. What impact have you had and are you having on a daily basis? So I'm sorry, I've forgotten the next part of the question.
Just what would parents say at the moment, and also whether the impact of the exec director leaving at the moment, how much of an impact will that have?
Sure, thank you. Well, it will be for parents to say, but as I've mentioned, anecdotally, we interface with, and I work with the chairs of the Northants Parent Carer Voice, regularly. And as I've said in the presentation, anecdotally, they have given us feedback through those summits, through those workshops, through conversations, that parents are noticing a difference in the education, health and care plan quality. But equally, they would reflect the frustrations that many parents continue to have, particularly around the areas that I mentioned earlier, around sufficiency, about mainstream inclusion, about where their children might go. So ultimately, the annual SEND survey, which the MPCV is delivering, will tell us what their sort of global view is of our progress to date. Our change of Director of Children's Services is obviously unexpected and inevitably causes anxiety and instability. What I would say is that our corporate leadership team have grasped that immediately, given assurance about the work that's going on to find out either initially an interim replacement and a solution to that. As a member of the senior leadership team, I'm given assurance to all of my services that it's business as usual as far as we can. We carry on doing the work that we're doing, and it's only a week or two after, it's 2 weeks, isn't it, after that person's departure that we're having an internal announcement tomorrow. And of course that will be communicated publicly as well. So yeah, thank you.
Thank you, Pratima. Thank you, Troy, once again. David.
If I could just add into what Troy has said, so not forgetting that we also have an independent chair of the SEND Improvement Board as well. So the infrastructure around SEND Improvement doesn't stop churning away. We have an independent chair, we have a partnership board that helps deliver that, and we have people like Troy and the rest of the team that will continue to drive that forward from a local authority perspective with our support within the corporate leadership team.
Thank you, David. That's reassuring to hear. Are there any other questions? Yes.
It's not so much a question really, but it's just to raise the point around the voluntary sector and the work that they must do for children, and I know they do, for children and young people with SEND. So Aspire is the new infrastructure organisation that the NNC is supporting as Groundwork. We're the lead organisation for that. So it's just to land in the room really that we're just mobilising, sort of tracking the nature of the different groups that there are out there and the size and scope. So it would be really good to put that piece of the jigsaw into this and see if maybe they are part of the solution going forward, and that's support for those groups at a neighbourhood level. So yeah.
Thank you. That's very welcome. I'm going to wrap things up now and just go to the recommendation. So the board asked that note the progress of the SEND Priority Action Plan and to support continued multi-agency commitment to delivering sustained improvements across the SEND system. Are we all happy to note that? Thank you very much. So we'll now move on to agenda item number 9, which is the Better Care Fund year-end performance report. I'm not sure whether I'm supposed to read this out, but I'm going to. The Better Care Fund has been crucial in supporting people to live healthy, independent and dignified lives through joining up health, social care, housing services seamlessly around the person. This vision is underpinned by 2 core objectives: to enable people to stay well, safe and independent at home for longer, and to provide people with the right care at the right place at the right time. I'm now going to hand over to David Watts to present this report. And David, thank you for stepping in to do so. It's appreciated.
Thank you, Chair. And apologies from Sam, who would have been presenting it. It's that time of year where there are leavers assemblies, and it's important not to miss that stuff. So I'm more than happy to pick this up on Sam's behalf. I won't go through the report in detail, but what I will do is bring out a few key messages and highlights and answer any questions, if I can, that board members will have. For those members who are new to the Health and Wellbeing Board, the Better Care Fund, or the Better Care Programme, has been in place about 10 years now. So it was launched in 2015 and was seen as a vehicle to support integration between public bodies, voluntary sector, in delivering integrated services that support people who are coming into contact with those services. This is one of a number of regular reports that come to Health and Wellbeing Board around a Better Care Plan. So this sets out our year-end submission, but we also bring quarterly updates to the board to set out that progress. So usually by this time of the year, there aren't many surprises in what gets submitted in the year-end report. However, in summary, all of the objectives and national conditions have been met by Better Care Fund partners. The planned allocation of just over £50 million of pooled budgets has been spent as tabled within Appendix A of the report, which is the template which gets submitted to NHS England. And all schemes use their financial allocation within the previous reporting year. We saw higher levels of demand than predicted on both Pathway 1 and Pathway 2. Pathway 1 very much being about that low-level support to get people out and back home. Pathway 2 being about providing domiciliary care in people's own homes. Pathway 3 is where there's a stopgap, a temporary move to, for example, a residential-based provision where we've identified that people can't be supported directly at home immediately after discharge from hospital. So Pathways 1 and Pathway 2, we saw increased demand, but were broadly able to manage that within the targets that we expected to. The biggest challenge for us was by far Pathway 3. The KPIs that we're monitored on around the pathways are based on the number of days from referral to when people start receiving the support that they're intended to on either pathways 1, 2 or 3. So for pathway 1, our target is 2 days. Broadly across the year, we're on target for that. I think it averages out at about 2.6 days. So just that bit of, odd cases being discharged 1 day earlier. We do have some challenges, for example, discharging over the weekend, which can be a bit of a challenge for us. Pathway 2, the target is 5 days, but we've performed above target for that, so that's positive. Pathway 3, the target is 7 days, but if you look in the template report, we're more than double that, which indicates where some of our biggest challenges are within the system. what we tend to find is our most complex people are coming through that route as well. We are trying to support them to get back home, but some of those challenges are not dealt with quickly. We quite often find that people are having ups and downs whilst they're in that acute setting as well. So we may be arranging discharge, but there may want to be some ongoing monitoring of people before they are discharged. But by far it's finding the right placements with the right support. There are 4 metrics which are measured across the Better Care Fund, so avoidable admissions, discharge to the usual place of residence, falls and admissions to residential and nursing placements. You'll see in the report that we met the target for avoidable admissions and discharge to usual place of residence. However, we failed to meet the targets on falls or admissions to residential and nursing placements. Falls, we have a little bit of concern around the data there, in that the system that had been used to monitor some of that data activity was changed partway through the reporting period. So we don't have a great level of confidence in the data that's coming out the system that we did have, the gap, and then the new system that was implemented. Admissions to residential and nursing placements, the target wasn't met, although we have seen slightly lower proportions on pathway 3. However, we have seen some significant improvements in comparison to previous years around performance against this indicator, and a lot of that's put down to the activity that we've been undertaking in Thackley Green, which is one of our discharge settings, which provides enhanced reablement to people predominantly coming out of hospital, but they do provide some step up from community as well. If I leave it there, Chair, happy to take any questions which Health and Wellbeing Board members have, and if I can answer them, I will. If I can't, I will get back to you with the answers.
Thank you very much, David. Any questions from the board on this report? Yes, Prince.
Thank you, Chair. Chair, I just wanted to find out, you did mention pathway 1 and 2 having some increased demand on them. What was the rationale or reason behind that in terms of that increased demand? And also, in terms of the weekend discharge, you said there is some issues around that as well. What are some of the mitigating strategies that had been put in place to kind of help resolve that as well, if you don't mind, Chair?
Thank you, Prince, and through you, Chair. So there isn't one reason or any themes that you can potentially pull out. What we are seeing is a greater level of acuity, so people being more unwell and requiring additional support on discharges, which tends to push them into pathways 2 and pathway 3. With regards to the weekend activity, there have been previous attempts to run weekend discharge services, but it requires quite a hefty financial input to do that activity from all partners, because discharge doesn't involve just one organisation. It involves the local authority, it involves the acute hospitals, it can involve primary care, and it can involve community nursing services as well. More importantly, it often relies on the availability of external providers, so domiciliary care agencies, residential care homes, and what they lack at weekends is senior decision-making capacity to be able to make a decision about people coming into that environment, and because they are registered managers of those environments, they are legally accountable for any decisions around those admissions. So the sorts of strategies that we do have in place is more about how we try and manage our flow of work over the week, so trying to discharge on Wednesdays and Thursdays ahead of the weekend, so that we're not going into a weekend with people who are medically fit for discharge but then waiting over the weekend just because we can't have that. So trying to really look at those people who will be available to be discharged mid to late in the working week, on a Monday and Tuesday so that we can start planning and sourcing the care and support. So those are the main strategies that we currently utilise in those circumstances.
Chair, can I just do a follow-up on that? So I sit on the International Recruitment Board, and also I'm aware of the issue around, care providers whose licenses have been revoked, talking about domiciliary and things like that, and how that would impact on. Are you seeing any kind of correlation with the issues happening around care providers and the current issue with their licenses being revoked, and how that also kind of relates to what you've just said? Thank you, Chair.
Thank you, Prince, and through you again, Chair. So we have had less exposure to international recruitment and some of the challenges that have been seen, particularly around agencies that have lost their licensing conditions to support international recruits. So as a local authority, our exposure has been less. Certainly within the Northamptonshire footprint, there have been a couple of those recruitment agencies that have been headquartered in West Northamptonshire. So there has been a greater exposure to some of those risks across the county, but predominantly located in that one area. And that's no criticism of West Northants. It just happens to be where those providers were headquartered in that sense. With regards to recruitment per se, we do have some areas of challenge within the social care sector, predominantly qualified nursing staff being one of the biggest issues that we have. With the best will in the world, most of our providers are unable to compete with Agenda for Change terms and conditions that the NHS use, and the costs of replicating that across the social care sector would be astronomical to be able to build that up in that sense. So there's a bit of a balance around how would you get that right, but certainly without, I would suggest, central government intervention to look at workforce strategy, or whether there would be additional ways of allocating resource to support local authorities to effectively fund that Agenda for Change cost, then it would be uneconomical for the local system to be able to do that at the moment. We do try and explore different ways of managing it. We have explored things like secondments from our NHS partners, and whether that could be supported, but we haven't yet found a solution to it. It's not something which is particular to Northamptonshire. It is a county-wide challenge, as you'll be well aware. Sorry, countrywide, not county-wide.
Thank you, David, and thank you again, Prince. Are there any other questions from the board? Or Pratima?
Hi, thanks, David. Just in terms of the kind of proactive care developments, how are you seeing Better Care Fund kind of influencing that development? But also in terms of the kind of your integration kind of enabler is vulnerable sector development and infrastructure. So obviously we'll be more than happy to work with you through Aspire on that as well.
Thanks, Pratima. And yes, absolutely. If you look through the schemes, there are a number of schemes that are funded that do invest in voluntary sector. One which you'll be most aware of, obviously, being a contribution to support Northants, which is one of our, we see it as a really successful partnership with the voluntary sector, which engages much earlier in people's health and care journey, not just in relation to health and care needs, but some of those wider determinants that influence people's health and well-being, so helping with things like debt, housing, those sorts of issues. So it's a really good partnership that coordinates and connects people to the right sort of support to help them through those challenges. So, and helpfully we've had an interim report completed by Public Health that has demonstrated some of the fantastic return on investment. Not that that's the most important thing, because outcomes are the most important thing. But certainly the return on investment was significant for every pound spent on that Support Northants initiative. So certainly from a local authority perspective, we're really keen to see how we can look for opportunities to grow that, look at how we could expand perhaps the people that are being supported, or the range of needs that people have that are being supported pre-adult social care eligibility. So thank you, Pratima.
Thank you, Pratima, and thank you, David, for that. We look forward to seeing that sort of work being expanded over the coming years and seeing more return on investment, I think, but more importantly, as you say, the outcomes are the most important thing, but thank you very much. Any other questions from the board? Not seeing any more hands, so thank you, David. The board is asked to approve the Better Care Fund end-of-year performance report. So I'll ask for a show of hands for the board. So those in favour? Those against? And are there any abstentions? No? Thank you very much. We can approve the Better Care Fund end-of-year performance report. Thank you. Before I move on to the next item, I just wanted to check on everyone's comfort because the room is quite hot. I know, Jane, you're fanning away. Does anybody want to take a quick 5-minute comfort break or get some water? Or are you happy that we plough on with the next agenda item? I just thought it was an appropriate time just to check in on everybody.
I'll say 5-minute comfort break.
Yeah, 5 minutes.
If says it, then everyone else has to go with it.
Okay. It's sort of inverse democracy, David. So what we'll do is we'll take a 5-minute comfort break. Please be back. We'll say just after 3 o'clock. We're making good time with the agenda. So, yeah, if you just want to go and get a bit cooler and then come back and take your places in 5 minutes' time. Thank you very much. Okay, I think everybody's taken their seat, so if we can bring the meeting back to order, we'll move on to the next agenda point, which is item number 10. It's the Pharmaceutical Needs Assessment report, and the report is to present Northants Pharmaceutical Needs Assessment from 2025 to 2028 for review and approval. The Health and Wellbeing Board has a statutory duty to develop and update the P&A every 3 years under the NHS regulations of 2013. The report is a summary of the key findings of the Pharmaceutical Needs Assessment, and I invite Pippa Williams and Amy Pownell to present the P&A. Thank you.
Thank you, Chair. And yeah, as you've mentioned, the purpose of this report is just to present the pharmaceutical needs assessment for the next 3 years to this board for review and then approval so we can publish. The legal implications of not meeting the statutory requirements are set out on page 144 in the pack, and we've previously been updated to this board. So whilst we are currently overdue on publication of a new P&A, if the recommendations of this report today are approved, we can publish a new pharmaceutical needs assessment to bring the board up to date with the requirements. We just wanted to acknowledge an error in the paper, so as it was prepared for before the date was moved, it does mention a publication date of June 2025. And as the date of this board has moved after approval here today, hopefully the publication date will then be this month, July 2025, and that will influence when the next P&A is due in July 2028. I'm now going to pass over to Amy Pownell, who's a public health practitioner with us, who's led the process, and she's going to provide a brief overview of the report.
Thank you, Pippa. So this report provides an outline of the legislative context of the P&A, which Pippa touched on there, and it outlines the process undertaken to produce the P&A, apologies, shorthand for pharmaceutical needs assessment there, to provide assurance to the board that it's in line with the national guidance. So the process to develop the P&A has been overseen by a Northamptonshire P&A steering group, and this process followed by the steering group adhered to the steps outlined in the national guidance, and that is fully detailed in the P&A document. In December 2024, this board agreed that the steering group would approve the P&A report for the formal consultation process, and this 60-day consultation was undertaken in March to May this year, and the responses have been taken into account in the final P&A, which is now being presented to the board for review and approval before we can publish, and this will be published on the Northamptonshire Council website. So after the publication of this P&A, the board has a responsibility to publish the next P&A within 3 years. However, it may need to be published sooner or publish supplementary statements if it identifies changes to the need for pharmaceutical services which are of significant extent. So the board will therefore need to put a system in place which allows it to identify any significant changes during the 3-year lifetime of this document, and the national guidance provides decision-making flowchart and sort of advice on how to support that. The P&A followed a structured process as outlined in the Regulations 2013. This includes establishing the aforementioned steering group, gathering and analysing local data, engaging with the public and contractors to understand access and usage patterns of the pharmacies, and mapping tools were used to assess geographical coverage to identify gaps in provision. The findings of this were used to determine the current needs and any future needs within the 3-year lifetime for pharmaceutical services within the P&A. The findings were that the P&A has not identified a current or future gap in the provision of necessary pharmaceutical services. However, it has identified that better access could be achieved through the provision of services on Sundays in East Northamptonshire. There are no resource or financial implications for the board arising from this finding and the proposals, and this remit sits with NHS England. The P&A document may also be useful to system partners when considering health inequalities, as it offers recommendations and insights regarding broader factors that affect the accessibility of pharmacy services in North Northamptonshire. So this report seeks approval of the board for the recommendations listed on page 142 of the pack. And the key recommendation is to support the content of the P&A for 2025 to 2028 document, which has been presented to the board today, and approve it for publication. The other recommendations highlight the ongoing statutory responsibilities of the board in relation to the P&A. Thank you, Chair.
Thank you, Pippa, and thank you, Amy, for that overview. I'm going to open for questions to either Pippa or Amy, and I can see Jane's finger out the corner of my eye, so over to you, Jane.
Thank you again, David. It's not a question, actually, Pippa and Amy. It's more of having read the pharmaceutical needs assessment, I just wanted to make a point about how important pharmacists are to our local populations and how many incredibly positive comments there were in the pharmaceutical needs assessment about the relationship, about the service, and with individuals sometimes, pointed out for being particularly helpful to communities. I mean, obviously we do need to think about East Northants, and we need to make sure that we have a really good offer for all of our residents, and that is more of a challenge for us, but it's really useful to take that recommendation back to NHS England. But I did want to just make a thank you really for the clear relationship building that goes on between our local residents and our pharmaceutical services. It clearly is really important to our local people. Thank you.
Thank you, Jane. Prince?
Yeah, thank you, Papa and Emmy, for such a in-depth, report on that. With the pharmaceutical need assessment, I'm also aware that, like Jane said, that this are very important for local people. I'm also aware of the online aspect of some of the pharmacists that wanted to kind of provide that to vulnerable homes and things like that. And it seems to me that we do get some, resistance on some of them going forward. From the ICB point of view, we tend to kind of approve that into the next stage. It seems that some are not being able to go through or, had to be appealed against, and whether there is something that can be done where we know that this online as well as, in person into some of these pharmacies are very useful and beneficial to our local people, especially those in rural areas who are not able to get into some of these places to pick up their prescriptions, and the online services will be much more beneficial for them. How are we helping, for example, online pharmacies that are trying to set up within the east of Northamptonshire, for example, to have those approved and serve our local rural vulnerable people? Thank you, Chair.
Thank you, Prince. And anybody want to pick up Prince's question? Julie.
Thank you, Chair. Thank you, Prince. Just, I'd be really interested to know which organisations are really struggling to apply for online, because we do have, I'm aware we've got one provider, I think, currently in the county, but there is a set process to follow. So you're going to email me, as you said earlier. So if you want to let me know where you see perceived blocks, then I'll certainly take that back as an action and follow that up, because as an ICB we are responsible for pharmacy services and obviously those pharmacies that operate within our county.
Thank you for that. I'll send the email through. Thank you, Chair.
Thank you, and we'll also record that in our action log for follow-through, so thank you very much indeed. David.
Thanks very much. Thanks for the analysis. Just on the engagement levels, you obviously kind of flagged those as low. Just reflecting on the 10-year plan, etc., and how we get that community into a mindset of modernisation and continuous improvement in line with what is set out there. Is there an opportunity to go back to them after the next 12 months in the 3-year period?
So I think in relation to the engagement, I think there were 2 points we highlighted. One was the response from pharmacies. So in particular, that was particularly low from the providers. And we did do quite a lot of engagement work. I think it was capacity on their side. So I think if there's a request to look at that differently, then we can definitely take that away. And I think likewise with the community, we did have more engagement and responses through the sort of usual channels, but still fairly low. I think in particular that response from pharmacies is something that we'd like to, for the next P&A, really look at. And I think if there is a request from the board, then we can take that away to look at in a closer time frame if needed.
Thank you. I think it's an excellent point, David. And yes, I think unless anybody on the board has a contrary view, I think that would be really useful to how we can increase engagement. And put some thought to that. Okay, I'm not seeing any other hands up, so we'll move to the recommendation. The board is asked to note the statutory responsibilities in relation to the P&A, support the content, and approve for publication. Can I just have a show of hands in favour? Any against? And any abstentions? No, thank you. I think we can safely say you're free to publish. Okay, moving on to item 11 on the agenda, which is the dental commissioning plan. Let me just read my brief here, see that I don't miss anything, Julie, before I hand over to you. So the dental commissioning plan has been produced by the ICB to set out their 3-year plan to address health inequalities and improve oral health. Can I invite Julie Lemmy to introduce the plan? Thank you.
Thank you, Chair, and good afternoon, everybody. For people who don't know me, my name is Julie Lemmy. I'm the Director of Primary Care for the ICB, and I have the responsibility of commissioning and managing all primary care services. So it's not, it's GPs, dentists, pharmacists, and optoms. So just in case anybody is interested. So thank you for allowing me to come. What I'm not going to do, Chair, if okay, is go through the actual presentation. I hope everybody's goes through. I'm more than happy if there are individual queries, then I'm happy for my contact details, email to be put out so people can reach out to me. So what I would like to do is just sort of provide a little bit of the context and then probably some of the headlines, because this document was obviously presented to the ICB board back in November last year and approved along with all of the other dental investment plans across the East Midlands. So I'm going to have to put my glasses on now so I can read my notes. But anyway, so what I'd say is I think the challenges around patients accessing services is well known, and you know, within Northamptonshire we are not any different to any other parts of the country, and there's been some real horror stories in terms of people not being able to do it, and obviously doing some horrible things like pulling teeth out, etc. So what we've done as an ICB, the first thing that we did was to update our oral health needs assessment, which obviously then helps to inform and make sure that any commissioning of services meets the population and needs of all our patients, noting that it is really difficult, you know, to get services into every place or every town within the county. So what that oral health needs assessment did was it had a refresh, and then it brought out some sort of key headlines, which were really that, you know, there are some issues in terms of trying to get the dental profession to sort of engage, because it's a really different model to, say, general practice. You know, it's a commercial model that they operate. And that bit's not actually sort of like being fully, as part of the dental reform, has not come forward yet. And that is a real major issue. And again, it's not just for Northamptonshire. So part of, obviously, that engagement is something that we took on board, and that is one of the issues. What we also need to do is trying to, very difficult to get dentists, but actually, do we need to have dentists? Do we need to sort of be looking at different workforce? And that is something that is really key. And clearly, you know, there is a, in the document and within this slide deck, you will see the headlines about, and it's, you know, children's services again, about children. I think part of what we have to do as a commissioner is to try and get that education in really quickly, because if you start with, you know, as they're young, then hopefully we can start to improve. So I think the first thing that I would say is that this is a key priority for the ICB. We've committed that we absolutely have to improve dental access services across Northamptonshire. So what we have done is, you will see that obviously the 3-year plan really talks about trying to get what we call access to services that are on a permanent basis rather than on a non-recurrent basis. So, but I'm sure you'll all be aware that as part of the manifesto, there was a requirement for us to actually go out and deliver urgent access, which we do know is needed as well. So our target within Northamptonshire is around about just over the 17,000, and that obviously was one of the key priorities that we had to do, in addition to looking at what we are going to do to get more services into our towns across Northamptonshire. So what we are looking at, and we are aware that we need to prioritise where we put our investment and where we put our services. So the oral health needs assessment actually sort of showed us that actually in Northamptonshire we need to really motor on and get some investment into all services. But we do need to focus on adult children, and, you know, the 20% of the most deprived groups that have been identified really came out strongly within the oral health needs. So those are two of our priorities. We also need to look at new patients and how they access if they haven't got a dentist already. And then we have the older population and then the younger population. So what we've tried to do is address the key priorities, and that is what's within our dental investment plan. What I would say today, it's not easy. The dental market is really litigious, so it makes it's really challenging to try and procure services, and, you know, we are having to work in that environment. And again, that is something that I think some of the providers have probably across the country become very good at doing, which makes it even more difficult for us to actually procure services. And we've currently got a challenge at the moment that is, we've tried, well, it's in another standstill period at the minute, but we're hoping that what we've done is robust, and we will sort of announce a new provider which will be coming for Wellingborough, you know, in the not too distant future. But that's some of the challenges that we are currently up against. So what have we done? Like I say, we've done in terms of the urgent appointments. We've got the latest update is we've currently, out of the 17,000, we've got 14,603 appointments across 3 providers. That doesn't mean to say we're not going to stop. We've got to carry on trying to encourage other providers to come so we hit that national target. In addition to doing that, what we have introduced, and we introduced the back end of last year, was to try and use what is known as the Golden Hello Recruitment Incentive Scheme to try and get dentists to come and work and stay within our county. We've been quite successful at that, which is good, but again, we need to do more in that area. We've also done a number of what we call non-recurrent awards, and that was really to try and boost activity because we know it is so poor, and we've tried to do that across the whole of the county. And we will continue to use non-recurrent schemes, but what we want is permanent contracts out there for long enough to make sure that we will retain dentists. So all of this work has been going on since the plan was actually presented to the ICB board, and we will continue to obviously address those and try and get some more services being commissioned throughout this year. But obviously our plan is for 3 years. It is a live document. It will need to be updated if we get any other further requirements coming down. But again, I think in terms of priority, it's certainly mentioned in the 10-year plan that's just been published. And again, we are committed to trying to improve oral health in the county and actually trying to get access to dental services. And believe me, we know that there is an issue and we're doing as much as we can. So in summary, within the investment paper, it gives you an overview of what the process that we've done. We've used our oral health needs assessment to inform our decisions. It does give you examples of the work that we will be doing in the coming year, and it shows the level of investment that we're trying to plan. And it gives you a broad outline of the next steps. So, as I say, that was presented to our ICB board. So thank you for allowing me to come along today to present that. And I'm happy to try and take questions and answer. But if I don't know the answer, I will come back to you. Thank you, Chair.
Thank you, Julie, for that update. It's very much appreciated. And I think the challenges of dental access and oral health, particularly in the young, is a significant one that everyone needs to sort of work together to try and improve. I'm going to open up for questions. So, Pratima.
Julie, thanks for that. Just from a Healthwatch perspective, in the very few months that we've been going, this has come up as a really key priority. You won't be surprised. So happy to work on anything with yourselves, particularly in terms of the areas you're suggesting. In terms of it'd be good to dig deeper into which particular geographical areas or communities of interest as well.
That's really helpful. Thank you.
Can I just ask about the prevention work and what that looks like in terms of in communities?
Thank you. So the prevention work, that's an area that we actually need to do more of. I mean, we do work already with the council on some small schemes about trying to get those messages out. It's something that we need to do further work on, but it's recognised that, and it's nationally recognised if you get out there early enough, then you can. So some of the things that we've been talking about is sort of like, getting into the schools and trying to, get those checks done more readily than they already are. I know that we did provide some funding to sort of, for toothbrushes and but we're really keen to do more of that. But I think, getting out there and actually sort of, taking, I remember doing it many years ago with the crocodile and taking the big toothbrush out and getting the kids to play with it. And it was amazing. They then took toothbrushes back to their parents and said, look, But I think that's really key. So it's an area that we need to do more of.
Yeah. Well, with a direct connection to that, there are so many community food projects, for example, where toothbrushes and toothpaste could be a big part of the offer. There are quite strong networks there that this could land in. I mean, I'm from the era of Sure Start, where it was very much, part and parcel of the 0 to 5 offer, and I think that is really powerful stuff if we can try and work on those networks. So.
Thank you, Kate. That's a really useful suggestion. I'm going to ask Jane to come in.
I'm just going to come in on the prevention piece, if that's all right. So Pippa might want to add to this, but a couple of things I'd say is, one, like any aspects of healthcare, prevention is key. And if we don't get that right, we're in trouble. And we do have issues with the number of children with decayed or missing teeth, filled or missing teeth below the age of 5. So it's really important, and there's a lot of work that is going on around getting children to understand exactly that, Julie, how to brush your teeth properly and how to brush your teeth. And, I've heard stories over the years of children having that introduced to them at school, and it's a new concept to them, actually. So it's such a fantastic opportunity to do that, and we are working with schools through the Healthy Schools programme. I think Pippa wants to come in on that. But I think from my perspective, the other thing is our infrastructure is very strong in the north, so our family hub network, we could be doing even more through that, and I think that will progress as time goes on. If we can get more children brushing their teeth, it breaks the cycle. They will teach their children to brush their teeth. And obviously we do need treatment services, I fully appreciate that, but if we can get people with healthier teeth and gums and better oral health, their chances of needing very significant treatment reduce. Pippa, did you want to make any additional comments from a public health perspective?
Thank you, Jane. I think there were just 2 points that I was going to add. So I think just a bit around some of the activity that does go on. So in terms of that prevention work, there is the programme of supervised toothbrushing, both in schools and also looking to other settings where there are some resources around those sort of toothbrush and toothpaste packs that can be given out, and engagement materials. Also, just to mention, there is a Northamptonshire Oral Health Alliance that meets, that's led by the Children and Young People team within public health, so we can definitely share details of that. I'm not sure, I'm not part of it myself, I'm not sure if there's VCSE sector sort of representation on that, but I can send a link to the team that lead that, and within that meeting they do discuss some of these ongoing activities around prevention and working together across the system on that.
Thank you, Pippa. Thank you, Jane. I think there's some really good suggestions there. Could I bring Louise in, please?
Thanks. It's a similar question, really, because I'm just reflecting on the high proportion of children with tooth decay, which is shocking, really, isn't it, nationally and locally, and wondering how much there might be a generational issue there with parents not accessing dentists for health checks, for oral checks, and whether that's then passing on that they're not then regularly taking their children as well. So I appreciate there's a lot of prevention work going on with the children, and as part of the health wellbeing strategy, that's great, but I'm also wondering what else, is there anything else we could be doing around parents and supporting parents to be able, to know to take their children for regular checks as well.
Julie, did you want to come back?
It's a great suggestion, and we need to do more in this area. So we haven't got all the answers, but I mean, thank you for the offers today. It's something that we do need to do, and I'll take this back and try and work with Jane and the team to try and see how much more we can do. Because I think you're right. The earlier we get to, with the children, then the better. I mean, there was talk of us having a dental van for the county. It is muted, and very only muted, that there's a possibility that may well be something that may come forward. And we certainly, when we were looking at it, we were hoping that we would be able to use that as a vehicle to get out into the communities to start getting some of those messages out. But it is like getting, you know, people out there talking and actually doing the doing. But yeah, thank you. That's been really useful and can take back.
Thank you, Julie. Chris.
Thank you very much. Yeah, it might be labouring the point actually, but just jumping on the previous point about, you know, locking in and piggybacking those programmes that are already in existence. So from our point of view, we're just thinking about the holiday activities and food programme, obviously for families that are eligible for free school meals, and it's got quite a wide reach. We provide a healthy lunch in the middle of it, so there seems to be a logical step to think about brushing your teeth afterwards. But we haven't got the resource for that, but we've got the route to market, if you like.
Yeah.
Thank you, Chris. Jane, did you want to say something or not?
No, just
okay.
Okay.
I think that just that short interaction really demonstrates. I'll come to you in a second, Prince. Just demonstrates how important it is to have a variety of people around the table in this board where we can have discussions like this and actually come up with potential solutions which will improve things for our residents going forward. So thank you everybody for that contribution. Prince, over to you.
Thank you, Brian. Julie, just a couple of things really. I know you've mentioned about the 3-year plan, and also you did mention that in Wellingborough there is going to be something in the foreseeable future. Can you narrow that down in terms of, you know, it's kind of an open-ended part of the suggestion given on there. And also you mentioned encouraging other providers to come on board. What mechanism is being put in place for that encouragement for them to come on board? And also, I think the last thing I was going to mention is the fact that the local organizations, of course, exist in terms of the schools and all the things that have been mentioned so far, but how effective are we on campaigning and making sure that those who are homeschooling as well are not kind of missed out of this, you know, campaign? Thank you.
Thank you, Prince.
Thank you. You know, they're really helpful. I mean, homeschooling definitely something that we need. I think there's also I think you've got to take it out there, and that's some of what we've got to do, and to our harder to reach groups as well, because I know we always talk about, you know, getting out to them, but actually over the last few years we've lost a lot of providers who have gone in this market, have gone privately because it's more viable for them to do that. So it does make it really difficult to commission new providers. I think we're working with the local dental council to try and actually get that, but we're also waiting for the outcome of the dental reform. And I think, you know, if we get a positive outcome from that, we might be able to get the market back to where it used to be, because it certainly has gone downhill across, not just within Northamptonshire, but more widely. And we've got bigger providers out there who don't necessarily always give you, you know, the service that you need, but know how to, you know, to put a reasonably good bid. So I think there is something about us working with our providers that we've got at the moment to try and improve. But I also think there is something about, you know, the use of other, you know, dental therapists. And again, that's something that I know this that is being muted, but actually, you know, they can go out and do some of the you know, the education and everything else, and it's trying to encourage the providers to look at, you know, how do they use their activity and actually go further than what they're doing at the moment. So there's lots of thought process going into how do we do it. We've got to be more creative. We've certainly got to be, you know, come and work in Northamptonshire. So we will be looking at all of those potential options to try and engage further with the dental market. But as I said, it is a really litigious market, and they challenge every time on any procurement, which then means it delays any new provider getting up and running, and can hopefully in our case it won't deter them to pull out altogether. So, but yeah, I take on board your points and add that to your email to me, and then I can respond more fully. Thank you.
That email's getting longer and longer. David, did you want to come in?
I mean, slightly left field, I guess, about the creative thinking, but I suppose when I go to Leicester, driving in London Road, and it's packed, I think it's London Road, it's packed with kind of private dental providers that can do crowns on the day, amazing technology, and yet we struggle here. So I don't know whether there's anything from the American model where, if planning is given and licenses are given to providers to set up private clinics, they have a proportion of public-facing work that they need to do. I mean, that's a consideration for elected members and the planning basis, but it'd be an interesting frame for Health and Wellbeing Board to kind of look at that in the planning sense. Just a thought.
Okay, technology, thank you. I mean, it is a good one. I mean, yeah, you can go down many. I think one of the, what we can do is what's known as flexible commissioning, and we can look at a contract and actually sort of convert some of their UDAs, units of dental activity, and so that they can do more work in specific areas. So, and that enables us to be more flexible in particular areas. So if we've got, a real high need in one area, then we might want to do a bit on prevention. We might need, they should all be doing prevention, but, to tailor that. So we do have the ability to do that. And I'm hoping that with some of that, we will be able to try and get some of that, the oral health backed. It's going to take us, years to do this, but we've got to start somewhere. So, but I'm really keen that we start to use all the tools in the box. But yeah, it's a good suggestion. Thank you, David.
Thank you, Julie. Thank you, David, for that. Yes, every journey starts with a first step. So I think that the debate's been really fruitful. So thank you, everybody, for that. I'm going to draw this item to a close now and move to the recommendation. So the recommendation for the dental commissioning plan is the board are asked to note the ICB dental commissioning plan. So I think looking around the room, we can all agree that we've noted that item. And thank you, Julie, and thank you, everybody. That was a great discussion. I'm going to move on now to the Family Drug and Alcohol Court. This presentation is to raise awareness of and support for the Family Drug and Alcohol Initiative. And I'd like to invite Rachel Sanders to present this paper. Rachel, over to you.
Thank you, Chair, and thank you for having me today. It's been lovely to listen to the work that's going on across the council. I don't know if you've heard much about FDAC, but FDAC is a model that was brought across by District Judge Crichton, who sadly removed his 14th child from a family that he was the family judge for, and then went to California to look at models for the court system to see if things could be done differently. And it's something that we see in our own court and across the country. And he brought the model back to London in 2008 and opened his first FDAC there. There's now currently 13 FDACs across the country. They cover 19 courts and 32 local authorities. So some FDACs are branching across and different ones. We're fortunate in Northamptonshire, we've just got our own. We work with families that are in care proceedings who have difficulties with drugs and alcohol. And we launched in April of this year, so I've been in post since January. So it's very new for me to be here in front of lots of people that are very important. So we've currently got 2 families that have been assessed and are currently signed up, which is amazing, given that we launched in April. And we have another family due to sign up on Monday and another 2 assessments due to kind of schedule. So we're very much up and running and getting lots of referrals. How do you do the next slide? Thank you. FDAC is an adult-focused, child-centred approach. So the child remains under the care of the local authority, and FDAC, we work predominantly with the parent. What we tend to find in proceedings is social workers are attempting to work with parents, but being the nature of them allocated to the child, it creates quite a lot of difficulties between them and parents not always feeling able to be as open and honest and ask for support. So FDAC, we predominantly work with the parent. There's judicial continuity, so we've got 2 judges for Northamptonshire that have been trained with our FDAC team over the course of 3 days by Centre for Justice Information, CJI. So yeah, we've all been part of that same training. So we've got District Judge Bridson and District Judge Pickup. The idea is that they kind of become part of that support network for parents in care proceedings, so they can step in from behind the bench. They're sitting alongside parents as opposed to that frontal approach of, legal barriers, parents behind, addressing parents by their first names, which is a very unusual concept, believe it or not. And it's really shifting parents to kind of engage in the care proceedings and feeling seen, is what a lot of our parents are saying. So it's a very different approach of practice for judges, and they've really took it on board and kind of jumping in with it, which is amazing. And those non-lawyer reviews are held every 2 weeks. So that's the kind of removal of that, what's the word? My God, my words have gone. Parents, legal representatives and the local authorities. So we're removing all of those every 2 weeks, and we effectively support that situation to happen in the court. We are an independent team, but we're funded by both North and West councils, and we've got support from Police Commissioning and CGL and Public Health. So a very collaborative multi-agency team that's kind of sitting independent and work with both North and West councils. So the idea is that we, in our first year, will work with 10 families, 5 from the North and 5 from the West, and then kind of hope to grow to 30 in our second year. So we're very busy. Yeah, I think that's that page. I'll hope to get through it as quick as I can. I won't chew your ear off because I could talk about FDAC all day. One of the first tasks for me in January is kind of networking. I think as a social worker, you tend to step back a little bit from the community. So kind of getting back out into Bridge, our CGL services, and actually meeting people face to face, not just emailing or trying to call people. It was about kind of physically getting back out in the community and getting to know the names of people that sit behind the desks. And that's created a quite incredible amount of support really for us, and our sort of steering group has just been full of professionals that have been really passionate about FDAC and seeing what that can do for the families in our community. So yeah, it's been quite incredible. And we're working with charities. As of yesterday, my team were very excited that I've managed to find a voluntary therapy dog as well, on top of everything else that we've managed to collate in the last few months. So that support network's just ever growing for us, and that's kind of why I'm here today, is just really keep us alive and keep those connections going. Yeah. So this is our team, which they were very unhappy with me that I made them give photographs. Myself, I'm from Northamptonshire. I did my social work training in Northampton and was part of the second cohort for newly qualified social workers in the academy. So very much born and bred Northampton social worker and over 10 years experience. Ellie Banks is our senior. She's also got experience in FDAC in Bedfordshire. So she did that for 4 years, as well as safeguarding experience, is now our senior. We've got Caroline, who's our substance misuse specialist, and she's from our CGL services, so they continue to fund her and second her into our team. She's been incredible, fountain of knowledge in terms of drugs, which is very important in our team. We've got Jess, who's our family support worker. She's also a qualified social worker, and hasn't yet done her NQSW, but she's got domestic abuse experience and wrote the perpetrator programme for Northamptonshire. So in terms of working with some of our more challenging parents, she's a really key asset. We've got Dr. Abby Harris, our clinical psychologist. She works with us every week, and she's kind of helped the building of our key work that we do with parents, and she also leads on formulations. I'll try not to go too much into detail about what we do on a day-to-day, because I'll probably, I could talk all day. We have an IDVA coming from the police. We've been supported with her. She's incredible. She's got a psychology degree, worked in mental health services and secure units, and is 6 years experience in drug and alcohol services, and now will be our trained IDVA. And we have admin, who are very excited, started a couple of weeks ago, and it's been a lifesaver for me. Yeah, so our aims, a primary aim of an FDAC team is to try and work to keep children and families together. It's probably one of the more complex things social workers deal with when there's parents with substance difficulties, because parents will often say they get bounced between health services. So they'll, can't work with you, support you with your mental health because of your drug addiction, but we're using drugs and alcohol due to trauma to manage our mental health. And they find that just continues to go on. And therefore that once those care proceedings start for families, 32 weeks is a very short period of time in which to change a whole lifetime pattern of behaviour. So our team kind of holding all of those services in one place, we're kind of removing a lot of those barriers for families. The idea of our assessment is very much what I say to parents the minute they walk in, is a cards on the table situation. Lay out 100% of the problem, I can help you with 100% of the problem. Only give me 80, I can only help you with 80. And already in the first few families, we're hearing families' feedback saying things, I've told you things I haven't even told my own mum. Things that social workers have never known, that they've suspected. Parents feel able to talk to us about it. And that's about giving them a safe space to do that. And it's about not judging them and understanding that they didn't set out to what we refer to them as unintended consequences. Our families in Northamptonshire don't deliberately wake up and just decide one day, I might go and use substances. It's often brought out of trauma and a difficulty that they just haven't had support with or understand. And then they've used that substance in order to help themselves, and that unintended consequence then on their parenting for their children. So we try to remove a lot of the shame and the language that's used when we talk to families and about families with the local authority. And it's been wonderful. Our first mum already, her self-esteem was very, very low. First assessment day, wouldn't say anything nice about herself, couldn't look at us really. And last week had her first review, and she said, I went out for coffee last week, and it's the first time I've ever done anything with people that were just nice, and they were nice to me not because they wanted something from me, which was really lovely to hear. And we said to her, but that's because you're worth that. And she's finally starting to say nice things about herself, which kind of choked us all up a little bit. But watching those parents kind of flourish and hoping that the result and outcome can be that the children go home. And where that's not possible, just helping that parent still make those changes on that journey, even if it isn't the right decision for that child. So it's a careful balance. But one of the things we do quite well in Northamptonshire is looking at children's behaviour through the same lens of that trauma. So we're just encouraging our social workers to do the same, but for adults. They've gone through the same traumas, it just still exists in them because they haven't had that support. So, yeah. I could talk about statistics all day. There is a new report that's just been published a couple of months ago, but I haven't yet updated my slides. I've been presenting all over the place. But the reunification for FDAC, so this is across the country, we all have to submit data, which then forms into a countrywide report. But the reunification in an FDAC is 52% compared to 12.5% for standard care proceedings. And the use of expert assessments is only 7.7%. If a family's with us first, 96.1%. And that's things like where a social worker may want to schedule a psychological assessment or an independent social worker. All of those assessments that go on top create cost. And the idea is that we hold that expertise in our team. So if a family's under us, we do that work to no extra cost to the local authority because they already fund us. So yes, it's just trying to save money like that. And placements, local authorities that have an FDAC in place are 28.6% less likely for children to be placed in care versus 54. And I think a lot of that is about the understanding of drugs and alcohol and the education that goes on, that better connection with our community services. So I'm really excited to kind of see what might happen for Northamptonshire over the coming years. And importantly, particularly for our health colleagues, the higher proportion of parents ceasing substances is 33.6 compared to 8.1. And again, because it's not just about the focus on that substance, it's about walking that parent through their trauma and helping them change their understanding of themselves, their ways of being, and then hoping to remain off substances for the rest of their lives. It's the hope. Yeah, I have included a video within my thing. You don't have to watch it now, but I would absolutely encourage you, if you haven't already, to watch it. It's Nikki, who was one of the first parents to go through Bedford FDAC, and she had her, I believe it was her second child removed in care proceedings, and went through the process of FDAC, and she talks about that support that she felt she hadn't had before from the whole team, because it is a team response. There's no one person allocated. They've got a key worker, but it's a wraparound. And she went through the proceedings with her second child. That child remained in her care, and now she's in the process of having her other children that were separated returned home. She's actually campaigning the government at the moment to bring FDAC into the fold, so that governments can kind of encourage the financial support, hopefully, of FDACs across the country. So she's been a real champion. But I would absolutely watch her video. She's wonderful. Apologies for chattering your ear off. I could talk FDAC all day. And if there's any questions.
Thank you, Rachel, for that enlightening and very powerful update on FDAC. I'm going to open to questions. David, do you want to go first?
Thanks very much. You brought a bit of joy on a June afternoon with that. It's lovely to see the humanity in the services we provide. And I really loved the annual report excerpt. I thought that was immensely powerful. Just a question on prevalence. So you talked about 2 people since April. What's your overall kind of estimation of need across? You cover both local authority footprints. Yeah. Thanks. Well done.
So our aim is 10 families in the first year and up to 30 in the second. In terms of what I suspect it could look like, very high. I mean, in the first few weeks of launching, we had, I think, 5 or 6 referrals, and that's bearing in mind that these teams take time for that knowledge to sort of drip out. We've had to be very mindful and look at each of those referrals. We are tracking all of them to look at what that need might be as we grow, and hope to obtain more funding then to grow the team in terms of social workers that can undertake more of those assessments. But I'm very mindful that we're at the beginning. We're a very small team, but I really do hope that it could be a big thing for Northamptonshire. Yeah.
Prince.
Thank you, Chair. Sorry, your name I can't see from here, so that's fine. Yeah, no, that's all right. That's good, Rachel. So, Chair, I'm thinking next to you is, we've got Kate, and then you got SN, and you got, Aspire Fountain down next to you in terms of publicity and making sure that message get out there, and also, following up on what David said in terms of from September, you got 2 families, but, how effective is the campaign? How effective is the medium of transmission to get more families aware? And more importantly as well, in terms of, underrepresented communities, we know that some ethnic minorities also go through some of these things, and also in terms of the attraction and how, that is being presented to be able to bring them on board and help them offset some of these issues in their lives and their families are very critical. I don't know whether that is something you've taken into consideration and you've got some framework around that.
Yeah, so we are working really closely with community partnerships, and we do have a subgroup, what we're calling our subgroup, and that's about pulling those professionals together to look at that. It is difficult in terms of the referral process because it is a local authority resource. So it's those families that are subject to care proceedings that we would predominantly work with. So it's more about us kind of reaching out to those community services for those families that we're working with at that time. But it's been incredible. Everyone that we've engaged with in all the services haven't had one pushback or we can't help with that. Everybody has been incredible.
I'll come to you in a moment, Louise. From my perspective, this seems to be quite an embryonic initiative. We're in the early stages of it, so I think we need to allow the team to work and expand and learn. I would certainly be keen to get regular updates on how the team's doing, so that we can keep monitor and support wherever we can. So that will be my ambition, but I don't think I could commit to anything other than that at this early stage. So over to you, Louise.
Thank you. It's just to add to what Rachel was saying, that within the families that we work with in social care, as you can imagine, there's a high proportion where there is substance misuse issues, and you might remember the term from years ago, a horrible term called the toxic trio of mental health, substance misuse and domestic abuse, and we see that in many of the families that we work with. So I think in answer to the question of how big is the need, it is very big. But the model that Rachel's described is quite an intensive model, quite a high level of support that is different to the normal support that you'd get through the social care system, with the specialists involved and really supporting and focusing on the families. So I think it's we've seen the national stats and the impressive statistics there. So I think you're absolutely right, Chair. It's that let's keep a watch on how it's doing in Northamptonshire, because I think over time the team will pay for itself, and hopefully we'll be able to expand and support more families.
Thank you, Louise. Anybody else want to ask a question? Jane?
More of an observation, really, building on Louise's point. I think it would be really interesting to bring this back to the board about, as you develop. Absolutely agree with you, Chair. It's embryonic, it's developing, it's great. From my perspective as being responsible for the drug and alcohol services in our area, I know that Change, Grow, Live have been really pivotal to the work that you're doing, which is fantastic. A life free of addiction is a much better life. And I think that in your slide pack, that letter that is to the prospective client, if you like, I think lays out exactly why that's so important. And I think that's a really important thing to consider. There's so many wider benefits to this, isn't there? So I think it'd be really great to see where you are this time in 6 to 12 months.
Thank you, Jane. I'd certainly support that. Okay, I'm going to move to the recommendation, which is that this board is asked to note the progress of this initiative. I think it's fair to say that as I look around the room, we support it wholeheartedly, and we look forward to you coming back and giving us some real spectacular stories about improving the lives of adults and children in our county. So thank you, Rachel. It's very much appreciated. So we note that for the record. So I'll move on to item number 13 now, and everybody will be pleased to know that that's the last item that we have on the agenda, apart from the close. So I'm going to ask, let me just read my script again. This report that follows the award of Healthwatch contract to support Northamptonshire in April 2025 and highlights the main objectives, progress to date and emerging priorities for Healthwatch in Northants. Can I invite Pratima Datani? I apologise if I got that wrong. Over to you.
Thanks. Can I just say, really great report. Really look forward to seeing what happens with the service. So I'm happy to present this report, but there's been, as everybody will know, significant development since we wrote the report. So the report was written just to highlight the fact that the contract was awarded to ourselves as Support Northamptonshire on the 1st of April, and I laid out kind of the core functions of a Healthwatch in that. Subsequent to that, on the 14th of June, just to say, we did do a soft launch in the community. We had a big event, so we kind of tried being out there and asking people about their thoughts around social care and health services. On the 27th of June, we were called to an urgent meeting by Healthwatch England on a Friday afternoon at 5 o'clock. The new, through the 10-year NHS plan, the recommendation is that Healthwatch England is abolished. The DASH review, which Healthwatch had contributed to, reported on the 7th of July, which also then confirms that arrangement. What that has meant is that the local authorities and the ICB still have Healthwatch responsibilities for another 2 years until legislation changes. So in collaboration and consultation with Jane, the contract is under public health at the moment, will be transferring to adult social care. It's been agreed that Healthwatch Northants has a contract for 2 years. We had already recruited staff who actually happen to be starting on the 11th on tomorrow. So what I'm happy to say is that the staff have agreed to continue, the newly appointed staff. So happy to say that we will have a Healthwatch Northants it's already live, but obviously with the staff coming in, they'll have a period of two weeks of induction, and then those staff members are local and well known in the county and Northants as well. So hopefully we want to hit the ground running with what we want to do. I'm sure Jane will want to comment on this, but in a sense, regardless of those national developments, we did want to work with around the Healthwatch remit in a much more radical way, because it really provides us an opportunity to engage communities significantly in all the areas. I think all the place-based developments that we've already been involved in, and of course working with Aspire and the voluntary sector puts us in a really good place where we've got a lot of those networks, and we don't want to invent anything new, really build on that, but really listen into what communities are saying about health and social care services, and help then work with yourselves to make those kind of changes and improvements. So reaching communities is going to be really key. The alignment with this, with Support Northants work that we're doing with Aspire, and the proactive care developments are really key. So we're really in the mode of kind of transformation and change, and anything Healthwatch can do in that, we really want to support. Just in terms of the kind of early indications on our soft launch, people were talking about access to GPs, hospital services, information about health and social care services, care at home services, and dental services, as we discussed earlier, and concerns around services to older people, aging services, and dementia-related work as well. Again, picking up indications won't be a surprise to this board, but those are the kind of early indications of priorities that communities are talking about across Northamptonshire. But been a challenging start, but happy to say that we are still there, and I'm hoping the new staff, I know the new staff will hit the ground running, and I really look forward to working with you all on that.
Thank you, Pratima, and I think I can say the feeling is mutual. We look forward to working with you, even though it's difficult circumstances at the moment. Jane, would you like to say a few words?
I will. It was a huge surprise to everybody, including me, that the announcement was made at 5 o'clock that Friday evening that Healthwatch England was being abolished. And we haven't had any further guidance on that. But as a health and social care system, we are completely committed to the voice of our residents, and we're absolutely committed to continual improvement. And so the first thing I wanted to say, Pratima, was a huge thanks to your staff who've taken that leap of faith to still join you just at the point, the worst possible timing, that announcement was made. I think that actually that they're showing huge commitment to our local communities at a really important time. I think there's huge potential for your role around the developing neighbourhoods models, for example. And I think that having, as you know, I do like to keep up with your activity and seeing the great stuff that you're doing via your website, etc. I think there's some really exciting times ahead. It has been important for us as a local authority to give you some assurance around that, because we don't want to destabilise what is a brand new and exciting service. And we just really look forward to working with you, Pratima, and we hope that develops and becomes something that is really pivotal to how we develop as a local economy going forward.
Thank you, Jane. Does anybody else want to make a comment or ask a question? No, I'm not seeing any hands. So thank you, Pratima, and I just echo what Jane has said. So it's a very difficult situation for you and everybody at Healthwatch, and we recognise that, and we will do our absolute best to make sure the next 2 years is very productive and fruitful. The recommendation here is for the board to ask to note the progress and support the development of the work programme with Healthwatch, and I think looking around the room I can wholeheartedly say that the board does that in abundance. Okay, well, you'll be very pleased to know that the next item is to close the meeting, but before I do that I just wanted to firstly thank you all for making my first chairmanship of this board a very pleasant experience. So thanks everyone for your contributions and for the warm way that you've greeted me in the meeting today. I appreciate it very much. I secondly would like to just thank Lisa, Jenny, David and Gordon, who have helped me prepare and have helped make the meeting run very smoothly today, I feel. So very often the people behind the scenes don't always get the credit that they deserve, and I just wanted to put on the record my sincere thanks for them for what they've done. So that's it. I officially close the meeting, and I wish you all a safe journey home, and I hope you enjoy the weather, and thank you for putting up for the